Perthes disease. Perthes disease in times of 1909 to 1910, Leg Calvé Perthes, three different scientists, three different places at the same time, they proposed a different theories about the pathogenesis of the Perthes disease. In leg, in Watson, it is due to the described it is due to the trauma. In Calvé in France, due to the abdominal osteogenesis. Perthes, Germany, he told about the inflammatory conditions leads to the Perthes disease. Next, etiology. Etiology, Femister proposed a theory that is a combination of the healing and necrotic bone intermingled with the granulation tissue and osteoclast. Radiographic confirmation, that is etiology due to inflammatory or infection. True etiology remains unanswered. In 1926, disruption of the blood supply to the female head, most important etiological factor. Many different forms. Due to obstruction of the superior retinacular artery, lateral epiphyseal artery interruption, double infection theory, there is a increased blood viscosity and thrombophilia. There is it is a multifactorial etiology. It is on genetic susceptibility and environmental triggers plays a role. Perthes disease. Definition of the Perthes disease. It is the disease of the children caused by the ischemic necrosis of the capital femoral epiphysis, which may vary in degree and severity. Following avascular necrosis, there is reossification always occurs in the Perthes disease. This leads to the permanent femoral head deformity and premature osteoarthritis. It is the idiopathic reason and is a self-limiting condition. Next, etiology. It is due to trauma, and due to trauma, there is a formation of the effusion in joints known as the hemoarthrosis. This leads to the compression of the lateral epiphyseal artery. This leads to the ischemia, and this leads to the Perthes disease. And there is a transient synovitis, leads to the ischemia. And in hyperactivity children, there is a attention deficit hyperactivity. In 30% have the attention deficit disorders, and there is a in blood related, there is a hypercoagulability of the blood. And hereditary factors also plays a role, and there is a type 2 collagen mutations, and passive smoking and maternal smoking, endocrinopathy, that is a hypothyroidism, and urban environment. Genetic susceptibility with environmental triggers plays a role. Type 2 collagen mutation are hereditary factors. Hyperactivity with subclinical trauma to the femoral head vascularity, and there is a insulin-like growth factor 1 pathway abnormality. Normally, insulin-like growth factor 1 pathway leads to the bone and brain formation. There is a deficit femoral head blood supply. Coagulopathy, thrombophilia, vasculopathy, there is a venous congestion, arterial occlusion, and inflammatory process like vasculitis. Maternal and the passive smoking leads to the Perthes disease. Next, pathogenesis. Disruption of the blood supply to the femoral head leads to the ischemic necrosis. Not a single episode that leads to the Perthes. There has to be multiple episodes of the infection to produce these Perthes like changes. There is a mechanical overloading leads to the deformation of the femoral head and the healing area. In normally, this is the articular cartilage, bony epiphysis, physis, and metaphysis. In articular cartilage, there is an increased thickness of the articular cartilage and the medial aspect of the femoral head. This leads to the lateral subluxation of the femoral head, and there is a deep inside, there is a chondrocyte necrosis. In deep layers of the cartilage, there is a separation of the cartilage from the underlying bone. This sign is known as the crescent or the Kefi sign, and there is a formation of the neovascularization of the cartilage. And second, bony epiphysis changes, necrosis of the marrow space and the trabecular bone. Trabecular bone compression leads to the fracture of the trabecula, and there is a fibrovascular invasion happens, and there is a osteoclastic resorption of the necrotic area, and there is a thickened trabecula due to the new bone formation. This leads to necrosis of the marrow space and trabecula, compression of the trabecula, long columns of the bone is missing, and there is a lucency of the bone. Around that lucency, there is a presentation of the sclerosis. This is known as a fragmentation stage because of the necrosis and fracture of the trabecula. After neovascularization takes place, osteoclast resorbs all these necrotic bone, also brings osteoblast, thickened trabecula due to new bone formation. In physis, there is a premature growth arrest in 30% of the patients. In metaphysis, there is a cyst and radiolucency. This indicates the poor prognosis. First, there is a femoral epiphysis ischemia. This leads to decreased mechanical stiffness of the head, that makes the bone less stiffer. That means this leads to the bone softer and ischemic. In this softer and ischemic bone, if there is a repeated loading of the weight, this leads to the micro fractures. No self repair is possible because of the ischemia. So repetitive micro damage. This leads to the vascular repetitive micro damage leads to the deformation and vascular invasion, osteoclastic resorption of the necrotic bone, and new bone makes the bone weaker. Repeated loading in the weaker bone, if the loading is takes place repeatedly, this leads to the bone further weakness. This is the image of the disruption of the blood supply. This leads to the cartilage necrosis and separation of the cartilage from the underlying bone. This sign is known as the crescent sign or the Kephis sign, and there is a necrosis of the bone marrow and trabecular bone. Bony fracture takes place. This leads to the fragmentation stage, and the next is revascularization takes place. In revascularization, osteoclast resorbs the necrotic bone and laid the new bone by the osteoblast. And there is a metaphysis, lucency and cyst also takes place. Natural history, vascular insult. Repeated vascular insult leads to the deformation of the femoral head, and revascularization takes place by the two forms. There is a lateral column. The lateral column are base filling or the mushrooming. Lateral column is a recanalization takes weeks to months. It is a good prognostic sign, and base filling or mushrooming are the new vessels are formed from the lateral aspect. It takes months to year. There is a formation of the softer bone, and there is a due to softer bone there is a chances of the deformation high. In the normally recurrent Perthes disease develops after interruption of the blood supply to the capital femoral epiphysis, vascular insult, changes. Epiphyseal changes over a period of 2 to 4 years. Necrotic vascular bone of the epiphysis gets resorbed and replaced completely by the new bone. The repair process partly entails the resorption of the necrotic bone by osteoclast and new bone deposition by the osteoblast by the process of the creeping substitute. The repair process follows a sequence that can be divided into the 4 stages, that is the stage of avascular necrosis, stage of fragmentation, stage of regeneration, and stage of the healed stage. In early stages of the vascular necrosis, the epiphysis appears dense and sclerotic. The subchondral fracture that may be identified in approximately 1/3 of the cases, and there may be a underlying epiphysis height is decreased. The epiphysis then loses some height. This makes the progression of the lateral part of the stage of the vascular necrosis. Fragmentation stage. Appearance of 1 or 2 fissures in the epiphysis that run perpendicular to the surface of the epiphysis. In due course, the epiphysis appears to have broken into several pieces. During this stage, several adverse events that are associated with deformation of the femoral head may be occur. The most important of these are extrusion of the femoral head. The anterolateral part of the femoral avascular epiphysis comes to lie outside of the acetabulum margin due to hypertrophy of the articular cartilage of both the femur and the acetabulum medially. Extrusion predisposes the femoral head to deformation. When more than 20% of the width of the femoral epiphysis is extruded, there is very high likelihood of the permanent deformation of the femoral head. In the early stages of the revascularization, new bone forms on the periphery of the necrotic epiphysis. This new woven bone susceptible to the deformation. If the lateral part of the epiphysis remains extruded at this stage, the forces transmits across the rim of the acetabulum them can deform the healing epiphysis. If the treatment directed at correction of the femoral head extrusion is delayed, if the treatment correction of the femoral head extrusion is delayed, there is a irreversible deformation of the femoral head occurs, and gradually mature lamella bone replaces the woven bone, and once this process completes, the disease is considered to be healed, known as the healed Perthes.